My name is Dr. David Conversi. I'd like to share with you some of the most effective ways that I've found in relieving the pain and discomfort associated with spinal osteoarthritis. And there's two main therapies that we use in our office that help out with this, and by themselves these therapies are effective. But when we combine these two therapies, they become even more effective and help out even more. And those two therapies are the chiropractic adjustment and also electrical muscle stim. Now, with the chiropractic adjustment, there's one main thing that the chiropractic adjustment helps out with, and that is the joints associated with the osteoarthritis. Now, a lot of times when we have osteoarthritis, the main cause or the reason for that is there's increased joint dysfunction, or those joints are not working or functioning properly for typically a long period of time. So when we're able to make those joints work properly and also affect the scar tissue or the tissues around that area, we're effectively able to reduce the amount of pain and make those joints work and function better and make sure they're functioning properly. With regards to the electrical muscle stimulation, the electrical muscle stimulation does three very important things with regards to osteoarthritis. The first thing is it helps reduce the amount of pain in that area. The second thing is it helps reduce the muscle spasms in that area. And lastly, it helps reduce the amount of inflammation in that area. So as regards to the reduction in the pain, when we're applying the electrical muscle stim to that area of the spine, a lot of times what we're going to do is we're going to put some pads in that area, and that current that's going to be going through that part of the spine is going to more or less act as a nerve block for those nerves that would typically be sending those pain signals to your brain. So it's going to effectively reduce the amount of pain that you're experiencing. Then with regard to the muscle spasms and muscle tightness, when that mild electrical current is going through those muscles, it's going to more or less relax those muscles and make sure that those muscles are not as tight and not compressing those areas as much either. Then when we talk about the inflammation and the help that the electrical muscle stimulation helps out with the inflammation, the electrical stimulation, when it's applied, has a pulsing factor or a pulsing effect, so it basically has a mechanical effect of helping to clear out any inflammation that we might have in that area. And the inflammation is one of the main causes or generators of a pain, and then if we can reduce that inflammation, it's going to reduce the amount of pain. So typically when we have people that come into our office that have osteoarthritis, they tell us after we're done or start treating them and have been in treatment is that they're going to have reduced pain, they're going to have reduced muscle spasms and tightness, and they're also going to have increased ranges of motion. Now those are really important things to have because those are things that they haven't had for a long period of time, and it's going to allow them to be able to do their duties at work for longer periods of time. It's going to allow them to, in some cases, work for the first time and also make sure that they're able to perform their jobs and duties at work better as well in a pain-free fashion. Next, when we talk about their activities of daily living, they are able to perform those activities of daily living without having the pain that was associated with it beforehand. They're able to take a shower or bathe themselves. They're able to put their clothes on without having the pain associated with those motions. And lastly, they're also able to sleep better at night, and they're not dealing with the pain that would keep them up and not allow them to fall asleep or stay asleep, and they're also getting more restful sleep at night. So if you're in pain, we'd love to help. Please give our office a call at 618-519-9334.